Hello, this is Dr. Tyson Furr, a clinical psychologist. Today we're going to talk about the thing that vexes men, which is when their penises don't work. Now, rest assured, I'm not going to give it medical advice. I'm just going to sit here and talk about this here book called the DSM-5TR. It is the Diagnostic and Statistical Manual of Mental Disorders. And as a licensed clinical psychologist, I am authorized to use this to diagnose people and come up with interventions. I'm not going to do the interventions here because I don't think that complies with YouTube policy. But when I open up my Patreon, maybe we can have more of a conversation. Waiting on Patreon for that. However, let's dive right into erectile dysfunction versus disorder. Erectile dysfunction is when your penis is unable 75 to 100% of the time not have an erection or keep an erection, or it gets really soft and it's non-functional. Erectile disorder is when this happens for longer than 6 months and it really, really upsets you and causes psychological distress. Now, what's important is that it's not better explained by a non-sexual disorder like depression. Like if you're depressed, you lose interest in things like sex and life. Or a result of a stressor, like say something really terrible happens to you, you're probably not going to be in the mood, and your penis will probably react accordingly. Or it's not also due to a medical problem like diabetes and nerve damage and things like that. Now, I'm a psychologist and my license isn't allowed to talk about those medical things, so I'm going to talk about I am licensed to talk about medical stuff, but I'm not licensed to practice medicine, so I can talk in my capacity about that. Now, there are two types of erectile problems. One is acquired and one is lifelong. And lifelong means like since the time that you were old enough to like have sex, it doesn't work 75 to 100% of the time. And then there's so that's lifelong. Lifelong means that since the time that you could have sex, you can't have an erection that works 75 to 100% of the time. Now there's acquired, which means that it was working fine and then something comes along and it just stops working like it used to. Now, to tell the difference between this, someone like myself or a urologist or some sort of person licensed to do diagnosis needs to sit down and have a careful history to see if it's a long-term, more than 6 months, more than 75% of the time, and whether it bothers you. Now the features of people who carry this diagnosis, it's not surprising. Low self-esteem, low confidence, not feeling manly. Other associated feelings are when people have prevalent feelings of guilt, or self-blame, or failure, or anger. And you can check out my other videos that speak to some of these things. And I'm going to go on even in more depth about those in a separate video. And there's also people who are worried about disappointing the other person. Also, there's seeing their partners as less desirable. This is where things like watching sexy videos can come into play, because people tend to view their partners as less attractive. Now, there's different subtypes of this kind of problem, which is, when you see the partner's health or sexual problems as an inhibition, then it tends to get in the way of your sexual functioning. Poor communication or different sexual appetites and negotiating these things can also lead to functional difficulties. And these are things something you can do about. People come from different cultures and religion, have different attitudes about sex. I'm in Japan, where sex is not shamed. In America, there's a heavy emphasis on being sexy and masculine, although I'll get into that a little bit later. But there's also the kinds of problems like surgeries and neuropathies and hypogonadism. And, you can look that up. Things like that, medical things, using medications and drugs. Some of these things will get in the way of your functioning, and it's not your fault. In terms of prevalence, not surprisingly, after 50, people start to experience more of it. That's the acquired version. And it's about 13 to 21% in the general population, in people who are 40 to 80 years old. In the 20s and 40s, the range of 20 to 40% is what you expect in someone in their 60s. And so let me rephrase that. If you're 60 or to 70, you're going to experience this 20 to 40% of the time in the general population. Once you hit 70, that number jumps up to about 50% to 75%. One Australian study had it at 80%. In the West, 20% of the men really worry that it won't work the first time they have sex. But in fact, only 8% had that problem. And in the United States, it doesn't really matter what United States is a pretty diverse place. So you'll often hear U.S. politicians and so on say it doesn't matter if your race, color, background, blah blah blah. But there are no cultural differences on any of this, or racial differences, or anything like that. This problem of sexual functioning is pronounced the first time you start having sex with somebody who's unknown, a new partner, or if you're using substances, or if you're experiencing peer pressure, like being told you go do that, or if you really don't want to. Not surprisingly, it just doesn't work. The sexual functioning doesn't work. Now, we assume it goes away without treatment, but we don't really know. And acquired sexual dysfunction seems to be more associated with medical issues, which of course increase with age. And, but sometimes it just, even if it does, sometimes it just goes away, all by itself. Other risks include smoking and lack of exercise, diabetes, or just not liking sex. These are more things where you can do something about, you don't need to smoke. You shouldn't smoke. I have a short on that. Exercise. Exercise is good for everything, not just sexual function. It's good for your body in terms of just its ability to survive, and the quality of life, the quality of your body, and protection from dementia, everything. So you should exercise. Now, safety first, consult your physician, blah, blah, blah. I don't want to say blah, blah, blah. No, it's important. Make sure that everything you do is done through the lens of medical approval, and, I can't emphasize that enough. Culture. What's really interesting is that in the U.S. and the Middle East, men worry about size, like the size of how large their penises are. They get really worried about that, and it gets in the way of, and then it's ironic, isn't it? Like, the more you worry about it, the less it works. Also in the Middle East, men tend to worry about their fertility, their ability to be like virile and make babies, and like, whether or not their sperm is going to be potency, right? Now, the ways you can test for this, one thing to see if there's a psychological nature is they used to call the stamp test. You can do it with many things, but what they would do is they put like a little band of stamps around your penis, and you'd go to sleep. And what you may or may not know is that when you're sleeping and you go into REM sleep, and people associate that with dreaming actually happens in other times too, but during REM sleep you get an erection. So if you wake up and the stamps are separated, then you know that you had an erection when you were sleeping, and it's all in your head. Or some degree in your head at the very least, meaning it actually does work, but you just don't know it. There's other ways of doing these things that increase in invasiveness, like Dopplers and nerve conductions, ultrasounds, but testing for diabetes, testing for thyroids and vascular problems. And the downside, and I'm going to do a video on depression, and I want to be very careful about depression, because depression is something that can kill you. Because when people in the depths are of depression, it seems like the end of the world. Well, killing yourself is the end of the world. Problems in life, I used to listen to a doctor who said that a man who was paralyzed from the neck down could actually have orgasms by someone stimulating his neck. That's true. I don't have any citation for that other than the show that was hosted by an ophthalmologist, Dr. Dean Adele. I don't know whatever happened to him, but his show was wonderful because he just reviewed medical journals. And so, this gets down to the heart of masculinity and what it means to be a man. And, some things, can't be overcome. Some things are just physical. The biology is a reality. But for many, many people, they just get in their own way, and psychotherapy can help. This is Dr. Tyson for Bunny.